Effective immediately, Ontario is declaring a state of emergency. We expect this to remain in place for at least 28 days. Everyone must stay home and only go out for essential trips to pick up groceries or go to medical appointments. All we're asking is for cooperation for the people. Please stay home.
Ontario declared a state of emergency today and issued a new stay-at-home order that comes into effect on Thursday. Officials also released stark projections about where the pandemic is headed in that province, suggesting that if things don't improve, the healthcare system will be overwhelmed and the number of deaths will top what we saw in the first wave of the pandemic. The new rules mean everyone has to stay at home except for essential reasons like going to the grocery store, for example, or getting exercise. Schools in 5 hotspot regions will remain closed until at least February 10th. That's just part of what was announced today. The Primetime panel is back to discuss what it all means. Brittany Andrew Amofa, James Moore, and joining us now, Raywat Deonandan, epidemiologist and associate professor at the University of Ottawa. Hi, everyone. Hi, Professor. Welcome back to the show. I wanted to start with you first on the projections that were made, what you take from that, like what people at home, because there's so much being thrown at them, should take from that. And then how does that match up from your perspective with what was introduced by the province today?
First of all, there isn't a lot of disagreement amongst experts about whether the projections are accurate. It looks like they're probably pretty accurate, and they're dire. It paints a pretty stark picture, and we're going to walk through the gates of hell, as one epidemiologist put it, in the next few weeks. So what should people take away from this? They should take away that the stakes are high, and that we are in the thick of the darkness at the moment, and it's about to get even worse. We're at the point of maybe compromising our entire healthcare system in Ontario, the delay of additional surgeries and other care to the point where we'll have suffering scaling up even further. So individuals really have to work hard to limit our individual exposures. That's the only way we get out of this, if we act at an individual level.
And so just quickly to follow up, based on what you heard from the province today, for example, the stay-at-home order, and I want to acknowledge that there are still a lot of questions, and I'm certainly getting them in my inbox from people who don't understand how it might be enforced, who aren't still sure 100% about what that means for them. How is it different than the lockdown we're currently under? Your perspective, your analysis on what was announced today, is it hitting the right note?
I think it is. I think it's in proportion to the direness of the projections, and probably will have some additional factors put on in place after with this if this doesn't work. So all these levers, though, all these policy options really are incentives for human behavior, and they only work if people follow along and if they actually do change human behavior. So we could stay home, but if we're spending time at home having parties and things like that, then it's failed. So it has to accomplish the goal of changing actual individual behavior.
James, how difficult is that? And this is something that we've talked about before, but we're at this juncture where, and we've discussed it so many times, people are, and I feel like fatigue is almost too light a word for it, right? They do feel like their movements are restricted. They do feel like this is going on for a long time. And at the same time, we're not seeing results, particularly in Ontario. In BC, it's a bit of a different situation. Just recently, they've started to see some improvements. How difficult is it for government to craft a policy that essentially has to convince people to change their behavior at a time when they don't seem super willing to do so?
Well, I'm not so sure that that's true. I mean, look, the public has altered their behavior. They do recognize the consequences of these things. The vast majority, which is said literally over 95% of Ontarians, over 95% of all Canadians, are abiding by these rules in good faith, mostly voluntarily. Yes, there's a stick and carrot approach in some parts of the country and some pretty sort of draconian threats that exist, at least on paper. But Canadians are compliant people who want to get through this and want to do what's right by their neighbors. There's an enormous sense of social and health solidarity one to another, and to get through this as effectively as possible. So, for governments, it's easier for some people to be critical and say, well, we've had some of these measures in place now for going on 10 months and it hasn't really worked. Well, we don't know that to be true, because had these measures and different iterations not been in place in the past, things could have blown up and become enormously worse. We know, for the most recent example, there was a much heavier expectation of lockdown in British Columbia, and here in BC, I didn't see any of my family over Christmas. On Christmas morning we Skyped and Zoomed each other and saw each other, and we did our best. But I haven't given my sisters a hug in a really long time, and I haven't seen my mother-in-law for now almost a year. So these are tough times, but you do it. And Ontario didn't do that, and they had the consequence. But I will tell you, certainly for governments, what this does do is it cranks up to 10 the volume of expectation and anger that they will have that politicians not do what they've done, what we were talking about last week, which is go on vacations or be hypocritical, and it cranks up to 100. The anger and expectation that the public will have that all levels of government get their act together when it comes to procuring vaccinations and getting them into people's arms now.
Yeah, and I should be more specific. You're right. I was referring specifically to Ontario, where it showed only a third of Ontarians, for example, over the break heeded the specific instructions on getting together. And you're absolutely right. That's not necessarily the case. Not necessarily the case everywhere. And when I say not working, I think the sense that people have is compared to the first wave, right? When we did all this stuff, and you certainly saw a flattening of the curve. In places like Ontario, it's not as bad as it could be, and for sure we don't know how bad it could be, but the cases are still going up, the hospitalizations are still going up. So I sense there's a bit of frustration there. That's all I meant.
But don't forget, in wave one, if what we want to call it that, which is to say March to May of last year, it was just flatten the curve, don't overwhelm the ERs. And we did do that. But of course, then came a second wave, then came summer. But there was a clear sense in most people's minds that this was going to be a 4 to 6 week experiment. We'll all lock down. We'll be past it. We'll bend the curve, go into summer, and we'll be fine. Hasn't happened.
Yeah, and that's part of the problem in this time around. There is, Brittany, we see the vaccinations, like that light they keep saying at the end of the tunnel, but that is a whole other conversation as well. And so you're just not sure how long we're going to be going through this. I mean, there is the incentive that it will end at some point because there are vaccines, but it's still difficult to pinpoint, like James says, this exact frame of time.
Yeah, and I think that's key. I think what's really important to remember here is that folks don't have a good sense of when this is all going to come to an end. And when we're living in this space of not being able to fully trust government, and not, when I say trust, I don't mean trust that they have our best intentions at heart, or trust that they're making the right decisions, or trust that they're listening to experts. What I'm saying, what I mean when I say trust is that trusting that people know what's happening or what the bigger picture is. And I think that's what's really missing here. And it's hard for me to blame individual behavior. I mean, there is indication that some folks did meet up over the holidays, but I know many people who didn't in Ontario and in Toronto specifically. And I know many people who did Skype, and many people who haven't seen their families for months. So we're really in tricky territory when we start to really dive deep into whether people have been adhering to guidelines to the 10th degree, or as strictly as they could be, because at the end of the day, we don't really know, and we don't really know people's circumstances. However, what I do like to bring into this conversation is that there are a number of different policy tools and levers that we could be using in addition to the latest lockdown or restrictions that have been put in place. And I know there's disappointment across the board as it relates to advocates, experts, activists, policy professionals who were disappointed to not see paid sick days included in the government's latest announcement, to not hear a strong plan in regards to protecting residents in long-term care homes, in regards to eliminating precarious work and temp work in long-term care homes. There wasn't a great mention of that. I know a lot of folks were disappointed to not hear, restrictions on travel. There are a number of different things that government could be doing in addition to these measures. And I think where erosion of, trust and the lack of adherence to public health guidelines can occur is when people know that there are other tools at government's disposal that they're not using. And I think that's something that government really needs to pay close attention to ensure that everybody's on board and everybody can fully get behind the latest restrictions.
Professor, I want to give the last word to you and just pick up on one thing that Brittany mentioned there, and that's long-term care homes, because the modeling and the numbers that were put out today, there was one thing that really stuck out to me and some of my colleagues I know, the number of people who have passed away since the beginning of the year in long-term care in just Ontario, nearly 200 people. Do you think the vaccinations will make a germane difference on that going forward? Because there is, I know we've had this whole discussion about how slow it is, or if it's quick enough, all that stuff. But that's where we started, at least. Lots of long-term care homes are finally getting them. Do you think that will end up making a difference in the months to come?
I think it will. Now, in Ontario, we have, 78,000 long-term care residents, I think, and we have that many doses at least. We should be prioritizing those residents to get these doses as quickly as we can. I think that should be one path forward to minimize the potential impact on the healthcare system, take the most vulnerable off the table through vaccination. And I think the vaccine planners realize that now, and I think that's going to accelerate further and probably make things a bit easier. So the answer to your question is yes. However, it can't happen fast enough.
Yeah, isn't that the truth? Okay, I'm going to leave the discussion there. Thanks, Professor. Appreciate you being with us. Raywat Deonandan from the University of Ottawa. James and Shachi are going to stick around. We've got a lot more to talk about. The group, meanwhile, that advises the federal government on vaccination says people can wait up to 6 weeks after their first dose to get the second. That is longer than both Pfizer and Moderna are recommending, and it has big consequences for provinces and how quickly they get their vaccine supply into people's arms. We're going to talk to the head of the advisory group to the federal government, but why that recommendation is being made in just a moment. Stay with us.